Good evening, everyone. My name is Harley Price, and I did my etiology report on C. diff. What is C. diff? C. diff is a bacterium that can cause symptoms ranging from diarrhea to life-threatening inflammation of the colon. C. diff most commonly affects older adults in hospitals or long-term care facilities and typically occurs after the use of antibiotics. There has been an increase of cases among young, healthy adults that haven't abused antibiotics or have been in a health care facility. On the right-hand side, I have included a frequency chart that shows the ages that are most commonly affected by C. diff. As you can see, cases are not very common in ages 0 to 13, and it grows more between 14 and 40, and the most outstanding cases are between adults that are 41 to 60 plus. The progression of C. diff. On the right-hand side, I've included a PDF file from the CDC that goes over the progression of C. diff. It starts with a bacterium that causes it and ends with if you're likely to get C. diff again. In my PowerPoint, I will go over all of these things, and I've also included a short video from the Mayo Clinic on C. diff and what it is.
Our body is home to trillions of microbes, mainly bacteria, which, together with their genetic material, are referred to as the microbiome. The gut microbiome refers to the bacteria in our gastrointestinal tract, and they exist in a mutualistic state, providing us with health benefits in exchange for a safe place to live. Our gut harbors a diverse community of intricately linked microbes which efficiently utilize all available nutrients, thus preventing pathogenic bacteria from invading the gastrointestinal tract. However, this healthy community can be tipped out of balance. In some patients with diarrhea, there is a harmful shift in the microbial community, referred to as dysbiosis, which results in loss of beneficial bacteria. This allows for the greater availability of nutrients such as amino acids like proline, the favored nutrient source for pathogens like Clostridium difficile. This change in the microbial and nutrient landscape supports the expansion and pathogenicity of C. difficile, resulting in increased toxin production and inflammation of the gut lining. Scientists at Mayo Clinic have identified clinical features that are predictive of dysbiosis, allowing us to prevent C. difficile infection by prophylactically restoring the gut microbiome. Male physicians have cured C. difficile infection by transplanting a healthy microbiome from one person to another, and this approach can also be used to prevent infection, but there are risks involved. Currently, researchers at Mayo Clinic are studying the use of beneficial microbes that can efficiently utilize amino acids like proline to restore the healthy gut environment and prevent colonization by C. difficile. Researchers at Mayo Clinic are studying the microbiome in a completely new way and beginning to understand how the human microbiome can affect susceptibility to infections while developing novel strategies for protecting patients at risk of developing infection.
The risk factors of C. diff include being 65 or older, recent hospitalizations, a weakened immune system, a previous infection with C. diff, and most cases often occur after taking antibiotics. So make sure whenever you're taking your antibiotics, you understand the treatment plan, how you're supposed to take them, and never overuse them. Symptoms of C. diff include diarrhea, including loose, watery stools, frequent bowel movements, fever, stomach pain or tenderness, a loss of appetite, and nausea. Symptoms present a few days after taking antibiotics. If you've experienced any of these symptoms, please go see your doctor. In order for you to be diagnosed with C. diff, you will have to submit a stool sample test. Once your results come back positive, you will be placed on an antibiotic such as vancomycin. It is a 10-day treatment, and in some cases, you can be hospitalized if your symptoms are severe enough with C. diff. If you've had C. diff before, please tell your doctor when you go in. A few easy ways for you to prevent the spread or contracting C. diff is to always wash your hands with warm water and soap. Use a separate bathroom if you are experiencing any symptoms at all. Take showers and make sure you wash really good with soap, and do not overuse your antibiotics. Life after C. diff. Here are some of the most commonly asked questions after a person has experienced C. diff. When can I return to work? You can return to work or school once all of your symptoms are gone, but make sure you do not do that until every last symptom is gone, even a slight fever. Can I still spread C. diff? The chances of you spreading C. diff after you have completed your treatment, your chances are low, but you can be colonized and you can still spread the germs, possibly. Can I be tested to make sure my C. diff is gone? Unfortunately, no. Once you get C. diff, you carry the germs for it, so there's no test to make sure that it is completely gone for you. Should you report your case to the CDC? No, you should not. Anytime a hospital or facility gets a case of C. diff, they automatically report it. And will I get it again? I will cover this in the next slide. The risk of reinfection. Will you get C. diff again? 1 in 5 people will get C. diff again. If you start having any symptoms, please go to your doctor immediately. For those with repeated infection, innovative treatments, including fecal transplants, have shown promising results. A fecal transplant could be another treatment for C. diff. A fecal transplant is typically used whenever a patient has had the infection at least 3 times. It is mild to moderate infection and has not improved in a week, or it is severe and it has not responded to therapy in 48 hours. A fecal transplant is when you get a healthy donor who has all of the bacteria that fight the C. diff in their stool, and it gets transplanted into your intestine, so those healthy bacteria are reintroduced. I have also included a short video from the Mayo Clinic to go over how fecal transplants works, and on the right hand side is a little flow chart on fecal transplants.
My name is Dr. Sahil Khanna, and I'm a gastroenterologist at Mayo Clinic in Rochester. My primary interests include C. difficile infection, both research and clinical care. We here at Mayo Clinic are now performing a novel and new treatment for C. difficile infection called stool transplant or fecal microbiota transplantation. The rationale behind this treatment is to restore a patient's gut flora with healthy microbes. The process of stool transplant involves the replenishment of healthy bacteria into a patient's colon with C. difficile infection. Typically, we perform this using a colonoscopy. In order to get this procedure at Mayo Clinic, our criteria include that patients should have had either 3 episodes of C. difficile infection, not responding to conventional therapies, or who are having C. difficile infection that is refractory to conventional therapies. The procedure is usually completed over a course of 2 days for 2 different visits. Prior to patients coming here, we recommend them sending their records to us to determine eligibility. Patients are then advised to identify a donor at home who is usually a family relative. Donors are screened for infections using blood tests for HIV, chronic hepatitis, and syphilis, and for stool tests for several infections. Donors are also screened by a battery of history questions for antibiotic exposure, hospitalization, and other risk factors that can determine their eligibility as a donor. Once a donor is identified, we ask the patients to come in person for an appointment, which includes explanation of the procedure, including risk factors, benefits, and alternatives. Patients also undergo a battery of screening blood tests prior to the procedure. The procedure involves the patients to undergo colonoscopy preparation to clean out their colon, which involves drinking of a liquid solution to clean out the colon. Donor stool is collected the morning of the procedure. 50 grams or less than 2 ounces of donor stool is used and processed in state-of-the-art labs here at Mayo Clinic using blenders specifically dedicated to this procedure. The stool slurry is prepared and placed on ice until the procedure can be done. Once the donor material is prepared, the patient undergoes a colonoscopy, and using a colonoscope, 250 ml of prepared stool slurry is infused into the cecum of the patient. In addition, we ask the patients to stop all antibiotic treatments for C. difficile the day before the procedure. These antibiotics continue to be stopped after the procedure is done. The usual response time is 1 to 3 days. We're very delighted that we're able to offer this procedure to our patients with relapsing and refractory C. difficile infection.